In this medical education research series, today I'm going to discuss an important topic with you, which is about how to develop AIM research questions and objectives. And during this, we will define what is the difference between AIM research question and objectives. We will also be using different frameworks like PICO, PEO, PCC, and SPIDER, and how do they inform how to write a good research question. I'm Professor Dr. Rehan Ahmed Khan, and I have a PhD in medical education, and I'm also a qualified surgeon. What we will cover today, we'll define the terms, as I said. We'll look into the question building frameworks. Uh, we'll go through 10 important study designs and looking into 10 questions. And we will look what are the common mistakes that students make while writing research questions. So let's come to the first concept, which is AIM. Remember that AIM is a broad, overarching statement which defines what your study aims to achieve. It should not include any methods or methodologies. It should just describe why you want to do this study. So for example, the aim could be very brief and to the point as to improve the quality of formative feedback given to postgrad surgical trainees. And we'll take this example of medical education and take it forward with the research question and objectives as well. So I hope you're clear about the research aim. The research question is a focused, answerable question that gives meaning to the aim. It operationalizes it. And a research question, depending upon the research design, is written, designed, or developed differently for every research design. For now, if we see that what was our research aim and aligning the research question with the research aim, you would see that the research question here is, does structured feedback training for surgical supervisors improve trainees' perceived quality of feedback with no training? Now coming to the final, the third concept here is the objectives. So many students would confuse that, the objectives should come first, or the research question, or the aim. The logical hierarchy is that aim is the first one to describe, followed by the research question, and then the research objective. And as you can see that research objectives are specific measurable statements that actually decompose the research question into its own components. So if you remember the research question, which was about feedback, so here what we're doing is to determine supervisors' baseline feedback quality, to determine trainees' perceived feedback quality after supervised training, and to compare feedback quality scores between trained and untrained supervisors. And when I'll give you more examples later on, you'll understand that how the aim, research question, and objectives were aligned. So we're moving from a broad direction to a concrete action, which is aim is a broad direction, research question is focused and answerable, and finally objectives. These are basically the components of the research question. Now, the most important thing is choosing the right framework for the research question. As I said earlier, we will be using these 4 frameworks to define our research question. There are many others, but these are the most common ones which are used. So let's talk about the PICO framework. It is mainly used in quantitative, experimental, and correlational studies, and systematic reviews and meta-analysis. What is population is who's being studied. The intervention is about what experiment you're doing. Comparison is about who's the your comparator group. And finally, outcome is what is measured through this research process. Then is the PEO framework, which is specifically useful for qualitative studies, which are exploring experiences, perceptions, or associations without an intervention. So mainly qualitative studies. P is population, which is who's being studied. Exposure is the experience through which the participant goes, or the phenomena or the condition of interest. And outcome is the eventual experience or perception which is being explored. Then we have the PCC framework, which is population, concept, and context. You can see that here the main difference from the PEO is the exposure. Here we are mainly talking about the population, which is, as you now know, is the group or participants of interest. But here the difference is of the concept, because in scoping review, we are technically studying an idea, an intervention, or an issue which is being mapped. And then the context it is in which setting this is being done. And this is primarily used for scoping reviews. Spider is again used for qualitative evidence synthesis, which is mainly, I would say, systematic qualitative studies. It's not used for the primary empirical studies. In here, S is sample, again, which is population. Then we have phenomenon of interest, then the design, evaluation, and finally, what type of research is being used. So now let's have a comparison of different frameworks. As you can see that PICO framework is best used for quantitative research and systematic reviews. The PEO framework is best for qualitative studies. PCC is scoping reviews, and Spider can be used for qualitative systematic reviews. Let's have a quick check on your knowledge. A primary qualitative study explores medical students' lived experience of their first patient death encounter. Which framework should structure it? So first you need to do is decide what type of study it is. It's talking about lived experiences, it's phenomenology. So what do you think is the answer? All right, let me take you to the answer. Answer is PEO, is because Spider is built for searching and synthesizing published qualitative literature, that is for reviews, as I told you, and for a primary qualitative study, PEO fits the best. Let's move ahead. Now we'll move to the quantitative study questions as the first one, and we'll apply different frameworks here. We'll talk mainly about correlational and experimental designs, but primarily on the PICO and PEO structure. Let's talk about a correlational study. So if you're planning to do a correlational study, which is like the research question is there a correlation or association between medical students' self-reported stress levels and their performance in OSCEs? Now, you need to identify that, this is based on PEO. So if we try to identify what P is here, that's medical students population. Exposure is to the OSCEs, and the outcome is the self-reported levels and their performance. So if we break down this research question into the objectives are to determine the level of self-reported stress among final year students. This is addressing this part of the research question. To determine OSCE performance scores among the same student cohort. This is addressing the performance component. To examine the relationship between stress levels and OSCE performance. So it is now establishing an association between the stress levels and the performance. So that's how you clearly tell and decompose a research question into smaller objectives. Let's take an example of experimental study. Does high fidelity simulation training compared with traditional bedside teaching improve final year medical students' competence in managing acute patient deterioration? Now, decoding the PICO framework here, the population is final year medical students, and the intervention is high fidelity simulation training. The comparing group is traditional bedside teaching, and the outcome is improve the competence in managing acute patient deterioration. And you can also see that the research objectives are again based on the research questions. So you can read through it. I'll not, you know, be reading this part of the slide. So quick check two, which of these is a component-based objective and which is process-based. Now this concept is very important. Many students, they commit a mistake by writing objectives which are process-based. When we align the research question with objectives, we're not asking you to write, or nobody's expecting you to write process-based objectives, but an objective which is reflective of the component of that particular research question. So if we write down to develop a simulation training module, and the other one is to determine a competence among simulation trained students. Now you need to decide which one is a component-based objective and which is a process-based. So let's have a look at which one is which. So B is competence-based and A is process-based, and that was very clear because when we're talking about A, it was about making a study guide, whereas B is competence-based because it maps directly onto the intervention and outcome elements of the research question itself, and that is something the study is measuring. So this distinction should be kept in mind while writing the research objectives. Now, qualitative study questions are about exploratory, descriptive, phenomenology, and grounded theory. So an exploratory study question is, what are the experiences of first-year residents in seeking help for burnout within a postgrad training program? And again, you can see that this research question is further divided into smaller components as research objectives, which is to determine residents' perceived barriers to seeking help for burnout, to determine the factors residents describe as enabling help-seeking behavior, and to examine the influence of the burnout culture on residents' help-seeking experience. Let's take you to the phenomenological study, and this is about what is the lived experience of medical students during their first cadaveric dissection session. Again, decoding PEO here, the population is medical student, exposure is about the first cadaveric dissection session, and the outcome is the lived experience. Again, you can see that these are the components of the research question and not the process-based objectives. Grounded theory study, how do clinical supervisors develop their approach to giving feedback to underperforming trainees? So again, you can see that how I have divided the objectives aligned with the main research question. I'm not going into detail because I have to finish this in time for you, and so this doesn't appears to be a very long tutorial. So the quick check 3 is true or false. So a grounded theory study should begin with fixed hypothesis to be tested through interviews. So I'm sure all of you must know that this is false because grounded theory is inductive and not hypothesis testing. Last, we talk about mixed methods and review questions because it is combining the quantitative and qualitative strands. And you can see that it is combining PICO plus PEO. The research question is, how effective is a near-peer teaching program for junior medical students in an anatomy course, and that's the uh, quantitative component. And how do students and tutors experience it is the qualitative component. And here we are using both PICO and PEO. Scoping review, as I said, is about testing your ideas. Researching about ideas or concepts. So we're using a PCC framework here, and it is about, the question is, what evidence exists on the use of artificial intelligence tools for formative assessment in undergraduate medical education. And for a systematic review, we're using a PICO framework here. The question is, in undergrad medical students, which is the population, does simulation-based training, which is the intervention, compared with conventional clinical teaching, which is the comparing group, improve clinical skill competence, which is the outcome. And again, the objectives are made such that they are aligned with the research question and also reflect as its subcomponents. For a meta-analysis, the research question is, what is the pool effect of structured mentorship programs compared with no mentorship on career satisfaction among medical residents across published studies? So till now, I've shown you examples of many different designs, and you can appreciate what the difference is between these different research designs. If you want to do something different, which is a realist review, the research question is about what are the context and mechanisms through which mentorship programs improve career satisfaction among medical residents, and for whom do they work best. Realist reviews are mainly process-based, and hence you can see that we're talking about context and mechanisms here. So a review asks what works for whom, under what circumstances, and why. What are the three components of its analytic framework? Think about what's the context here, what's the mechanism here, and what's the outcome. And this is the another framework which I did not share with you in the beginning, in which we talk about mechanism as well. So this is the framework, which is a CMO framework used for realist reviews. The context, mechanism, and outcome. This is the hallmark of a realist review, as I said earlier. So now, finally, what are the common pitfalls? What not to do? So please don't write process-based objectives. So avoid objectives which describes the workflow as to design a stress level questionnaire, to collect and record OSCE performance data, to analyze the collected data statistically. These are all process-based objectives, and these are not, and they do not qualify as a research-based objective. The research-based objectives are to determine the level of self-reported stress among final year medical students, to determine OSCE performance scores among the same cohort, which basically describe what is the aim of your research, so that aligns with the aim of your research, rather than defining how would you do that. So poorly written versus well-written research question. It's a poor question if you write, is teaching good for medical students? And the improved version is, does interactive case-based teaching compared with traditional lectures improve diagnostic reasoning skills among third-year medical students? Think about it, what framework has been used here. And again, there's another example of poorly written versus well-written objectives. So these objectives, for example, understand teaching is very broad, not measurable, to look at students' opinion. Again, it's not specific, not measurable. You should be writing objectives which are specific, measurable, achievable, reliable, and time-bound. So just look at this one. This is eventually what research is about, that are the aim, research question, and objectives aligned or not. Let's take a misaligned set. To improve teaching in medical college, And the research question is, what is the prevalence of burnout among nursing staff? And objectives are, again, to distribute questionnaires and so on, which basically are process-based. So you can see that the research questions shifts population and construct. The objectives are generic tasks that do not investigate either. Whereas in the line set, you can easily see that the aim is being addressed through the research question and objectives very clearly. These are my references, and key takeaways are: move from broad to specific, match the framework to the design, decompose a research question, please don't describe your workflow, and keep every element aligned. And thank you very much. If you have any questions, you can send it to me on surgeonrehan@gmail.com.